it is best that you understand and know what to do and know when to seek medical advice when your child is suffering from abdominal pain, severe constipation, or diarrhea. Does your child have ASD or Autism Spectrum Disorder and is also suffering from constipation? Well, constipation is the most common bowel problem in individuals with ASD or autism. In this video, we are going to talk about the potential links between ASD and constipation. We will also discuss what is constipation, what are the signs of constipation, and how to treat constipation. We will also talk about the goal for a child with ASD and what are the tips that you can do to help your child. Hi, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. Autism and constipation. Autism and constipation links. Well, some studies indicate that there might be a correlation between autism and constipation. Most likely, the higher incidence of children with autism suffering from constipation, the higher incidence is due to other conditions which are common in individuals with autism rather than because of autism itself. The complications that arise from the specific autism symptom that affects how a child functions. These include diet, social jitters, as well as fluid intake, aggressive behavior, medications, as well as treatment plan for a child with autism. ASD or Autism Spectrum Disorder is associated with higher incidence of gastrointestinal symptoms, and constipation is the most common GI symptom that is reported. This, of course, has a profound impact on children with autism as well as their families. Factors that contribute include diet. Children with autism can have certain food sensitivities. Children with autism can have aversions to a food texture or taste, which can lead to a limited diet. And a limited diet, whether it might be due to food aversion, food allergy, or food selectivity, can have a profound impact on a child's bowel movement. Another factor can be from fluid intake or lack thereof, which of course can contribute to constipation. Another factor are medications. This has a huge impact on a child with autism and constipation as well. Ask your doctor if your child's medication can impact his or her bowel movement. Another factor is due to anxiety. Well, children with autism can be anxious for different reasons. Social situations can make them uncomfortable. Changes in routine can make them worry, as well as feeling insecure. Also, children with constipation can experience painful or embarrassing symptoms, which causes them to fear it. And this fear leads them to being anxious and worrying and causes them to withhold stools, which leads to bowel and bladder incontinence. And this creates a vicious cycle. Stool withholding is also related to anxiety, like anxiety because they have to use different toilets, or anxiety about not being able to use a diaper, for example. And another factor is rigid compulsive behaviors. Children with autism exhibit compulsive and repetitive behaviors. They may be very resistant to changes in their everyday lives. This can be frustrating to parents, caregivers, and this may take a toll on the child itself. Now, what are the signs that your child might be constipated? You should keep a journal and watch out for these. It includes pooping less than 3 stools per week, having small, hard poop, having a huge poop that might clog the toilet, poor appetite. Also, if your child is complaining of belly pain or abdominal pain, if your child is posturing, such as walking on straight legs, on tiptoe, and then arching his or her back, if your child is straining while pooping, and if there is anal pain or bleeding. How is constipation treated then? Well, treatment for constipation involves 2 stages. First one is disimpaction, which would clear the blockage, and the next part is a maintenance protocol, which would prevent the recurrence of constipation. What is the goal for a child with ASD who is also suffering from constipation? And what are the tips that would help your child and you as well? Before we go to get that, do you have a newborn or you're an expectant mom or dad and you want to learn more about breastfeeding? How about sleep time? How about gas or colic? Are you worried about postpartum depression? I have developed an online training video series with the link provided in the description section. It's called 5 Newborn Care Strategies. Do check that out. Now, what is the goal for your child? It is the same as for any kiddo. It is for your child to have adequate nutrient intake and to promote your child's lifelong health. The Academy of Nutrition and Dietetics recommends that your child be in the care of a dedicated team that involves a dietitian to assess the adequacy of the nutrients that your child is taking and to check if there are any deficiencies, to address barriers such as food selectivity, food allergies, and other problems that might arise, and coaching the whole family on how to plan your child's meal. Now, tips to aid in your child's constipation. First, increase fluid intake. Have water available in several places and increase fiber in the diet. Limit the intake of processed food. Increase foods that promote gastrointestinal health, and consider a fiber supplement. Another tip, train your child's body by having your child sit on a toilet for 15 minutes with a timer after each meal. You can provide distractions or you can try to prevent boredom by having your child play handheld video games while sitting on the toilet. There are also certain exercises that might help with constipation, and you can teach your child that, such as the Kegels. Another tip, if your child likes to squat while pooping, you can provide a stool for your child to squat on. And you can read stories to your child about pooping. And ask help from your doctor. Your child's pediatrician might prescribe or change your child's medication. Your doctor might also recommend a fiber supplement or an over-the-counter remedy that would help your child's constipation. It is also worth considering a visit to the pediatric gastroenterologist to provide guidance. Hey, if you liked this video, watch my other videos where I teach you about other child health problems.